Don't forget to like, comment, and subscribe for your regular dose of Asian health information.
So, someone having shoulder pain, normally don't recommend doing overhead activities. So, for example, if you're stacking books on a high shelf, or say you're cooking and you're going to put a pot on a high shelf, normally those kind of activities I'll try and tell patients with shoulder problems to try and avoid. Also, if you're engaging in any sort of recreation, I usually tell patients to try and avoid swimming, a certain particular stroke of swimming that involves freestyle. Because when you do freestyle, you tend to raise your arm up above the level of your shoulder, and that can lead to compression of the tissues in there and give you more pain. Also, if you're working in the gym, I recommend patients not to do overhead pull downs because, again, lifting your shoulder up above the level of your shoulder is going to give you pain. If the patients are doing other type of exercises, for example, push-ups or load bearing across the shoulder joint, generally I won't advise that as well. Another exercise that's becoming very common these days is actually planking, and the patient's entire body weight is resting on their elbows and their shoulders, and that can actually precipitate any pain that they might have. So I'll generally tell patients to avoid these kind of activities. So this is a simple model of a shoulder. The shoulder is actually a ball and socket joint, and for you to be able to move the shoulder in all directions, this ball rotates within the socket. So the ball is called the humeral head attached to the arm bone called the humerus. Now, to control the humeral head and the arm, you have muscles that come from the shoulder blade. They cross across the shoulder joint and they insert onto the bone here. These muscles are called rotator cuff, and you have 4 of these muscles. You have 2 at the back that control external rotation of the shoulder. You have one on the top called the supraspinatus that controls arm elevation. You have another one in the front called the subscapularis that controls arm internal rotation action. So when somebody says they've got rotator cuff problems, it could either be an inflammation of these tendons, what we call tendonitis, or it could be a tear of the tendon, where the tendon is actually detached from the bone. Now when it's detached from the bone, these patients get a lot of pain, they don't have any strength, and they're unable to lift the arm up. In that situations, they require surgery to repair the tendon against the bone. So a stiff shoulder is otherwise called frozen shoulder. When you have frozen shoulder, what happens is that in the shoulder joint, you have a tissue around the entire joint called a capsule, and that tissue hardens or stiffens up. And that prevents movement in all directions of the shoulder, be it forward movement, backward movement, or sideways movement. So patients can develop frozen shoulder with no underlying cause at all. We call that primary frozen shoulder. And most of these conditions are self-limiting. They do get better, but they do take 18 to 24 months before they improve. So along the way, we do tell patients to go and see a physiotherapist to try and maintain movement and maintain strength. We also prescribe analgesia to try and bring down the overall pain levels to a little bit more functional, even though they're having an inflammatory process going on inside their joint. I think it depends on the kind of problems that triggered the pain in the first place. If it's a minor strain of the shoulder, say you're moving houses and you were lifting a lot of boxes and you overexerted yourself, if you rested your shoulder for 2 or 3 weeks, the pain will get better. But say you had a major injury or problem with your shoulder, such that your range is very limited, or there's profound weakness of your shoulder, those conditions may not recover by themselves by resting it. In those situations, I definitely recommend seeing an orthopedic surgeon or a shoulder surgeon to get yourself evaluated. So I see a variety of sports injuries in my clinic. Everything involving racket games to team sports to even patients who do things like running or exercises. They tend to injure joints such as the shoulder, elbow, hip, knee, and even the ankle. Most of the sports injuries that I manage involve muscle and ligament problems. People who pull their muscle or stretch their muscle or strain their ligaments or even tear ligaments. These patients make up the bulk of the patients that I see. Of course, there are more serious sports injuries like patients who dislocate their joints when playing sport or patients who sustain fractures. Now, these tend to be emergencies, and most of these patients come into the emergency department and they require more urgent treatment and a lot of times it requires surgical attention for these problems.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.